Hello, everybody out there in listener land. Welcome back to another episode of Therapy Without the Couch. Again, as always, the disclaimer it's not actually therapy. This is just a funny name I'm giving this. I'm not your doctor. You need to come see me in person if you want me to be your doctor. Today, we're doing something new and unique. I am joined by a special guest. She will introduce herself in a moment, but we're doing something a little bit out of the box today. Sometimes I'm just talking at you guys, but we wanted to have a dialogue here. And Diana reached out because she wanted to, well, you can explain. Why are you here? What are we doing today?
I'm here to have a conversation to kind of like normalize, I want to say, the conversation about what we do, what we do.
Well, I guess tell us who you are, right? Because you're
Well,
another clinician.
I'm a clinician.
Yes, exactly.
But I'm also a customer, a client, a patient, or whatever you want
A
to call
former
it.
patient of mine from, I think,
Yes,
6 or 7 years
yes,
ago. I had to check.
yes,
Yes.
yes. It's been a long time. So I was listening to you one day, and I was thinking about this relationship between clients and therapists and being both.
Yes.
I just wanted to talk about it and normalize the conversation on both sides. So that's kind of like
Yeah, because I think people misconstrue. They don't realize that we need this too, that we get our own help too, and that we have feelings too. And I think that informs what we do, right? Like, I don't know, in your schooling, did you have to go through any kind of therapy or counseling? Was that required?
it wasn't really a have to. I did because I needed it, and
Yeah.
that was the whole reason why I started my career in the first place. I was
Right?
trying
That's
to
often,
understand
right? Yeah.
what
People
was
end up
going
in this
on with
field because
me.
we all need some help.
It was curiosity. It was like, this is going on with me. I didn't have the financial to actually go out and seek help
Yeah.
or the insurance.
Yeah.
So I was like, well, I might as well go to school and learn about it. So that's how it all started. But I think there's so much to talk about when two clinicians are sitting down, but also me being a client and starting as a client, bringing that into the space. And a lot of times people don't know. Like people
Yeah.
don't know what happens.
Well, you don't get to
Space-
see inside, right?
Exactly.
Like, and I think TV has gotten a little bit better at making it look realistic, but you still don't know. You can't sample the product, right? Because of confidentiality. And so let's say that to those out there in listener land that Diana, she sought me out. I am not coercing her. She's not a current patient.
No.
This is all with permission. A lot of people don't understand how confidentiality works. They think that we're not allowed, I can get in trouble for this. But you hold the confidentiality, and so if you waive that, then this is yours. So
Absolutely.
we can
And
tell your story anytime you want.
exactly. And this is something I do regularly. I go around, I talk about, and I share with my clients when it's appropriate. I
Right.
share with my students when it's appropriate. I go to conferences and I share with people only because I feel that, again, as a clinician, sometimes we hold also to a higher standard, and people don't understand that we go through everything or most of the things that normal people go in life. And I'm on a mission to normalize this conversation, not only for clinicians, but also for everybody out there that seeking help, going to therapy, speaking about your story or whatever happened to you is so therapeutic, it's so healing, and it's so necessary so we can break that stigma, right, that is out there.
It's the stigma, and there's actually a branch of therapy which we did a little bit of with you called shame attacking, and it's let's not have that shame.
That too.
Yes.
That too, definitely.
Because the shame, then what happens is something that happens to us, then we feel like it's us. But it's why am I feeling the shame? Like, I didn't do that thing. That's not on me.
I'm so glad you're bringing that up because shame was a huge part of my journey. And you know that.
I know that, yeah.
We talk about it so many times. And I talk about it so many times with myself. I have to remind myself that it doesn't have any please, any power in my life anymore. Like the shame is real when you go through something in life, when you're going through trauma, when you're going through anything.
Well, anything. I mean, that's why in AA meetings, what's the first thing you do? You have to stand up and say, "Hi, my name is Todd. I'm an alcoholic." You need to face that shame. The shame is what keeps us hidden, and the hidden is what makes it hard to heal. Because then you're not facing the thing, you're not owning the thing, you're not telling people the thing. You feel bad about the thing.
Yeah, like the very first times when I started talking about my story and where I come from, I remember like it was an overwhelming feeling of shame.
Yeah.
And even though I kept doing it and doing it and doing it, always that feeling always like was there. It was present. It took years, and it's still, sometimes
No,
it's there. It's like a shadow. It's like looking at me from a distance, and I see it, and I know it's there, but I don't let it overpower me anymore. because I'm proud of who I am. And then you can't really own the story if you don't own where you come from.
Well, and it's accepting all of it,
Yeah,
everything that you are and everything that's happened to you. And I think that's partly the shame, but it's also partly not integrating reality, right?
exactly.
You can't take power over something if you're not accepting that it's there. And you can't we're talking, and by the way, we haven't gotten to your story yet, but we're talking about trauma.
Yes.
And trauma is something that it can't not affect you. So pretending it's not there or it's going to change you in some way. And so you have to own it and see that this has now shifted the narrative a little bit for you.
Yeah, and you have a good point there. Like trauma will change you if you don't change it.
Right.
Like if you don't do something
Well
about
said.
it.
Yeah.
And I saw that in myself and the hiding part, the secrecy, the pain, the suffering that you go through on your own if you don't really work on it. I've learned that again as a patient, and I've learned that as a clinician, as a
Mm-hmm.
therapist, seeing my
Mm-hmm.
clients get to the point that I got when I was suicidal. I tried to end my life 3 times. I had all these very dysfunctional relationships in my life. I would engage in relationship with people that would literally like prove
Mm-hmm.
how I was feeling,
Right.
which was not great. I was feeling like I was just a piece of,
Yeah.
you know what. So I would engage in relationships that would be, like show me that this is who you are, and allow people to treat me in that way. And then all of that changes you. It changes everything about you.
And let me interject right there. That's something that a lot of people don't understand. But after you've suffered some type of trauma or something that has changed your self-image, then we unconsciously, and that's key, we unconsciously end up seeking that out again.
Mhm.
So a lot of people feel like they fall into this victim role or this victim mentality, and that doesn't honor the victim or the survivor, whatever language you want to use. But it is a pattern. We seek out these patterns because we want to believe that we want one sense of self. And I think now, if you see yourself as I am broken, or people are inherently bad, or this is what I deserve, or this is how relationships are, well, then we just go out and find that. And there's a reason that that keeps coming to you, and it's not because that's all quote unquote you deserve, but it's what we end up pursuing.
Without
Right.
even knowing that we're
Without even
pursuing
knowing.
that, right? I think it's a trauma response. It's something that
Yes.
we do automatically without even knowing we're doing it. And then we're creating more of what we say we don't want, which is the pain and the suffering and the self-esteem, the lack of
A lack of
self-esteem,
self-esteem. Yeah.
the shame, the shame, that comes with all of those dysfunctional relationships. So it's
So
a cycle.
in whatever words you're comfortable, what can you share with the people watching or listening here? What was your trauma experience, or when did this take a different turn for you?
Yeah. So for me, it started when I was like around 7, 8 years old.
Mhm.
I went through um, sexual abuse by an uncle. And can you imagine at that age, like you don't understand, you don't know what's
No,
going
of
on.
course.
And and we know it's been researched and it's been talked about so many times how kids don't talk about
Right.
an abuse for many multiple reasons. It's the shame that comes with it. It's the fear of not being believed. It's also that most of the times it's a family member.
Right.
So how do you even bring that up? And then the confusion, like not understanding what's going on. Is this okay? Is not okay? So it started there for me.
Hmm.
And then it moved into um, later in life a rape
Hmm.
by my best friend's ex-partner at the time, and losing that trust in women for me was huge, because that was like, now I have this perception as I'm understanding more what sex is
Hmm.
and what abuse looks like, right, as a young adult. I rely a lot on my girlfriends. Like I
Sure.
had
Yeah.
friends and had
Support.
connections
Hmm.
still with women. And then this betrayal happened. And for me, it was the beginning of this roller coaster. Like I started engaging in, again, very unhealthy relationships, but
Sure.
also
Yeah.
depression started settling in, like getting very comfortable. Anxiety, I started having panic attacks. I, by this time, I'm already 23, getting divorced with 2 kids, being a single mom. I had come from Cuba a few years prior. So you also have that change, right? That adjustment of,
Right.
coming to a new country, not speaking the language,
Right.
not having a lot of resources. And it just, it, I can't even, sometimes I look back and I'm like, I don't know what happened. I don't know. I can't tell you how I ended up where I'm at, quite honestly. because I don't remember. All I remember when I think back is on the floor, crying, depressed, suicidal multiple times. Then feeling that shame of like, I mean, like if you survive a suicide, you understand that there's a lot of shame involved afterwards when you realize what you did,
Right.
and then you don't really want to die. You just
Right.
don't know how to cope with everything
Living is
happening.
hard.
Yes.
Yes.
So, so I remember one day I was like, okay, so I need to go to school or something. I can't afford going to therapy
Yeah.
or talking to anybody. I think, back in the days, like now we have a momentum going.
Yeah.
There's something going
Now
on. People feel more
it's
comfortable, right?
okay to be out there with mental
It's
health
okay to
issues.
be
Yeah.
out there and people talk about the Me Too movement.
Yeah.
And
Yeah.
there's a lot of things that have happened. But back in the days, it was lonely. You couldn't really talk to anyone.
And let me interject there. That's something that's so important, and it's something that's been coming up more in the conversation. That why are women just coming forward now?
right?
And it's because now it feels like somebody's going to listen. Now it feels like I'm not going to get a finger pointed at me.
And
It's
even
like
if there is a finger point, I feel like there's a movement
there's a
going on
community.
that
Yeah.
people, the community will support you, and then women feel more comfortable.
Yes.
But back in the days,
Yeah.
it was just not okay.
Yeah. There's going to be a label, or there's going to
There
be a
was a
stigma.
label.
Yeah.
There was not only the stigma, but also um, this sense of people treating you differently. You're damaged goods.
Damaged,
You're
yeah.
not,
Yeah.
good enough. Like,
Yeah.
can you really do this job or have this relationship with this individual if you have that in your past? So there was so much going on.
Yeah.
But the point is, I started going to Berry University,
Yep.
and I enrolled in my program, and I used my case as my case study
Right.
all the time.
Yeah.
So that was my free therapy. I
Learning
just
about
raised
you.
my hand. I know a friend.
Right.
My friend has been
My
through
friend,
this.
yes.
So, so yeah, that's how it started. Like I was that friend, but it helped me so much because my classmates, obviously, at some point, people started realizing like, we've been with you for a few years, and that friend is
Yeah, we're
like,
starting to.
like
She
you know a
seems
lot about
like,
that friend. And it was a roller coaster, but I think that was the beginning for me. And then stepping into my master's and like really practicing, because we do a practicum, we
Mhm.
actually get out there. It started showing up that my trauma was
Oh,
not
yeah.
properly treated.
Yeah.
So I had a supervisor tell me like, you need to go get help. And I was actually, who gets fired from a practicum, from an internship that you're working 20 hours for free? I did. Because my supervisor looked at me and she was like, no, you need to. And I
We need to
actually
take care of you before
we
you
need
can
to
take
take
care
care
of
of
somebody else.
you. Yeah. And it's interesting because they give you a list of places that you can pick for your internship.
Right.
And I'm like, I'm gonna pick this one, the victims program, where people are raped and abused. And because imagine, by this time I had already a list of very abusive relationships.
Sure.
Men that will, pick me up or put me down.
Mhm.
All these, you name it, all
Yeah.
types of abuse.
All
I
bad
went
stuff.
through that.
Yeah.
So I picked that program. And once I was there, I was like, oh my God, like this person went through this, or this one is going through this other thing. And I just couldn't be neutral. I just couldn't really.
But look,
that's
why do
it.
you pick that, right? Looking back, why would you pick that? You pick that because I want to feel like there's people who've been through something like me. I want to hear somebody's story because I'm still not ready to tell my story, but this normalizes it. It makes me feel less alone or different.
Exactly. And there was really no story to tell because I was still in it.
Right,
I was
right.
suffering.
Right.
I was still in pain. I was in survival mode for so many years. And this is something that trauma, individuals that have been through trauma, especially women that have been through sexual abuse and physical abuse, we master the art of surviving.
Absolutely.
We do.
Absolutely.
I mastered like by this time, I was
Well,
for
it's-
the world, I was okay.
And so, yeah, exactly. Surviving to the point that it looks fine, like nobody would even suspect. Look at you, raising kids, having a master's degree. What's
Exactly.
She must. Nothing's happened for her.
Like life, like for people would tell me, "Oh my God, you're so lucky, you're so blessed." And I was, but
Yeah,
I was suicidal.
yeah.
I would literally go home every day and think about how can I die tomorrow morning. That was my go-to. When I tell you that anything will go wrong, and my mindset will be like, I just want to die. I just want to die. I just want to die. I only attempted 3 times, but I had suicidal ideations for.
But let's explain
Over
that to
10
folks
years.
out there because that's also trauma's got its own stigma, but so does suicidal thoughts. And I find so often for patients, it's just I need to know that there's an escape hatch. it's not necessarily that I want to die or exit this life, but I just want to know that I can turn off. I just want to know that I don't have to face this tomorrow. And that brings a weird sense of hope.
Yeah.
Like people think that that's such a dark thought, but that's a feeling of hope in the midst of that kind of
Well,
depression.
1 in 11, I mean, one person dies every 11 minutes in the United States by suicide. And that tells you that a lot of people are thinking about it.
Yeah.
And then the number of suicide attempts and survivors is even, I
Yeah.
don't even know, triple that. So suicidal ideations happen
Yes.
for a lot of people.
Yes.
They just don't know how to talk about it, number one,
Because
right?
again, shame. Yeah.
For the shame, but also who's going to be listening on the other side and what are they going to do with that information? And,
Right.
and that's a whole complete different,
Yeah, that, we could go on for hours
I can
about
go
that.
on and on, but it's like suicide, it's complicated. Like people don't
Yes.
understand it. It's a very complicated subject because you look at somebody and you're like, why? Why do you want to end your, like
Right.
that's so
Not
definite.
you. Yeah.
Right, it's so definite. It's a definite thing. You do it and that's it. You're done. But in that moment, the pain is so much and so big to handle that I think for people that are going through that kind of pain, it seems like a way out. Right
This is
here,
it.
right now.
Yeah.
Right? Like I just want to end this
I can be
pain
done.
right this moment. And of course, every time I will survive a suicidal attempt, I will be shameful. I will be regretting it. I will look at my children and I will cry for days and I will get even more depressed. Like just thinking that, oh my God, I did this and nobody knows. That was the other thing.
Right.
Sometimes I would just take pills and
Yeah.
wake up 2 days later being like surprised that I survived and nobody found out.
Right.
Nobody. Because my kids were away with their dad and I was alone at home. And
So then, Diana, when did or how did you start seeking out? I mean, through the program, you were like studying psychology. So, but then when did you start trying to get treatment or therapies or because you tried a whole slew of things. You've done all kinds of things.
So by this time, I'm already doing my internship for my master's, and the supervisor fires me from the practicum, and I got really upset at her. Like I was so mad at her. Like, how dare you
Right,
fire me from
right.
an internship? I'm working for free.
Right.
But then I got into another program that was addiction, and believe it or not, even though I've never been in recovery for anything
Mhm.
substance use, which I'm very grateful for, because the pain that I was in, sometimes I wonder, like, how come I didn't
Right. Right.
use any drugs? I mean, I will drink a lot when I will binge drink when I will go out, but I never tried any drugs. But the point being is that in those rooms, there's so much openness and vulnerability and
Yes.
transparency that was the beginning for me of understanding what therapy looked like and
Mhm.
group therapy
Right.
specifically.
Right.
So I had a huge breakdown. I don't know what happened in my life at that time. I can't really remember. A lot was happening, but I ended up towards the end of my program and actually exiting my internship. I tried to die by suicide for the third time, and I couldn't understand that. I was doing okay. I was stable. I hadn't started therapy yet, but I felt that I had enough information and tools, and I was in those rooms, so it was therapeutic for me. And that's when I realized, like, I really need to do this, like the real way. I need to find help. And I started going through therapy at the time. I found God. I rely a lot in um, my faith and my belief that, there's a God and everything happens for a reason. And then I started going to retreats, and it was just like I said once to you, it was a combination of
a journey.
things. It was a journey. It still is a journey.
We're
And
all
this
on
is
the
what
journey.
I want people to know, right?
Yeah.
That
Yeah.
this
Done.
is not a one-time thing.
Oh, no.
Because I get clients like that all the time too. It's like, oh, I only need 2 sessions, 3 sessions. Let me just talk about this and it's over.
Well, that's my joke with my patients. I've been in and out of therapy for my own stuff over many years, and so I will pause therapy. I think I'm good. Then I come back to therapy, and I'll come home and I'll tell my wife, like, oh my God, I had this big breakthrough in therapy. I figured out this thing, and she starts making this smirk, and I go, I figured this out already, didn't I? And she's like, yeah, like 2 therapists ago, you came home, you were very excited, you figured it out. I'm like, well, I figured it out again, because we cycle back through some of our patterns, and we get re-triggered, and new stuff comes up that's the same old stuff, and yeah.
And then the more you do it, the more you really get to know yourself, which a lot of people don't get to that point. Unless you have a trauma, divorce, grief, something going on specifically, A lot of people they just don't wake up one day and they're like, you know what, I'm gonna go to therapy and get to know me better. And this is what I tell individuals: you don't have to wait for something to be happening in your life.
Yeah.
Like, you can get to know you and how you do you, and then start building from there and creating whatever you say you want to create in your life. Because we all the time we say, I want this, I want the perfect relationship, I want to be more of this.
Right.
But how do you do those things unless you start like really going peeling that onion, right?
Well, and some of it is it doesn't need to be reactive to something negative. Therapy
Yes.
can also be positive. If you want to get stronger or fitter, you hire a personal trainer to go to the gym because you've been going to the gym, but you need a little extra help. And so I think sometimes it's the same as that. Like
The
it's
exact
I
same
need a
thing.
little bit of push, I need a little bit of guidance. I sort of been doing this on my own, but I feel like I'm not quite having the breakthrough I want. And so maybe you can guide me. But it doesn't all have to be that I had a breakdown or a suicide attempt. It can be
Exactly.
I'm just not quite where I want to be. Like I feel like it could be a level above, you know?
And there's this misconception that therapy is a space of I'm going to be told what to do and I'm going to get a recipe. Like somebody's gonna give me a script and then
Oh
I'm
yeah.
gonna know. And I tell my clients this, like, this is not about, like, I don't know
No,
anything
I don't have
about
any
you.
answers.
I don't have any answers. If I tell you, like, where I come from and my life and everything, like, I'm not, no, like,
Right.
that's not what's gonna happen. This is a gift for you. I'm just gonna reflect back, ask questions.
Right.
You get to know you, and then you get to, like, learn ways to observe yourself and pay attention to yourself, and then have this toolbox, which is what I think I have these days. Obviously, my toolbox is bigger than most
Right.
people because I'm a clinician, but it's going back to basics sometimes, like knowing that, okay, I'm engaging in this behavior that I know is not supporting me or not adding value, or it's something that I used to do, and I can look back and realize and reflect and kind of like shift on my own without having to go back to
Right.
in this specific. I'll give you an example. Like, I don't know, I used to have a very very bad relationship with time.
Mm.
Like, I was always late. I was
Mhm.
always um overcommitting. I
And you
would
were on
tell.
time today, which I was very impressed
I
with.
know.
Yes, I noticed. I noticed.
Uh-huh. So, and then when you do that, you're all over the place. I
Mhm.
was all over the place.
Yeah,
So,
you feel frantic
so I'm
and
like,
frazzled.
always running around and like, and then that shame, that, stress that I'm not really following through on my word.
Mm.
I'm not perfect. I still have times when,
Sure.
I might be late for something, or I might not be my word. I might say I'm going to do something and I don't do it. But I've learned that for me, it's important to be in integrity with time and with myself. So if I say I'm going to do something, I'm going to try to do that something I said I was going to do. And if I tell you I'm going to be here at this time, I'm going to do my best to follow through. It does something for me. It makes me feel good about myself.
Yeah. Yeah.
It builds me up.
I'm being responsible. I'm in control. It feels
Exactly.
it creates a momentum of goodwill about yourself.
Yeah, and those little moments add value. So this is what I teach my clients to, like, find whatever that is for you, whatever is building you
Right.
up.
Yeah.
But if I'm engaging in behaviors and doing things in my life that are taking instead of adding, I now can pay attention to that and be like, oh, wait, this is not adding value to who I am and who I want to be.
Yeah. Why am I doing this?
Exactly. Let me shift.
Yeah.
And then I shift and I start
But that's
being
where therapy
intentional.
comes in, because sometimes I know I want to shift, but I just don't know how. Or I've tried and I feel like I keep running into the same problem. And that's something I think we should demystify for people, that there are lots of different types of therapy. And on television, there's a lot of that, like somebody just has the aha and they point to you and they know what
Do
all
you
your
ever
problems
see
are.
those movies or shows where, like, people are like, oh my God, aha,
Right.
aha. And you're like, that's not what happens in therapy most of the time. It happens sometimes.
Right. I get a few ahas a year, but it's so rare. Yeah. It's slow. It's
And
it,
then life is wonderful and they're cured.
Yes.
And I'm like,
yeah, and you feel good. And that is also, there are certain types of therapy, not just on TV, but in real life, I think, where it's very dramatic, but then that doesn't create lasting change. And so a lot of it is that everybody hears talk about cognitive behavioral therapy. Man, that is so slow. There's no ahas in that.
For real.
It's changing habits
it's a great
and
modality,
patterns. I
but
love
it's
it.
very
But
slow and it's not for everybody.
and that's part of it too, is knowing what works for you as the client or the patient and matching that with your clinician, with your doctor. Like, I was looking back at some of the work we did, like what were we doing for Diana? And a lot of it was holding space.
Yes.
A lot of it was talking without shame, learning to set boundaries. It was interesting. I was remembering you set an interesting boundary in one of our first sessions. I was following you on social media because you were another clinician in town, and so I was just networking. We had never met, and then you show up on my couch, and somehow I mentioned, "Oh yeah, I saw something about your trip," and you realized I follow you on social media, and
I remember
you got
that.
very much like, well, I don't know how I feel about that. Like, I think I need to set a boundary. I don't want you to know that. And
Yeah.
that was a great therapeutic exchange. That was you
Yeah,
saying that
is
and
so
us
true.
discussing that. And where's that? There's no name for that type of therapy, but it's important that we give that we have that space setting.
And everybody's different. For me, I realized that I like to figure things out on my own.
Yep.
I get very frustrated when people try to give me answers, which is
Don't
funny because
mansplain to me.
right, but a lot of people like they want answers.
Yeah.
I'm the opposite of that. Like if you try to give me the answers, I'll get mad. Like let me hold the space.
Right.
Hold the space and hold me high to know that I'm going to figure it out. And I appreciate that. I don't like when people try to like just, and I remember that day because I was indeed starting to learn more about boundaries in my life. Like, how do I do this with my mom? Remember, with my family. In order to protect my space and my healing and my recovery, I wanted to have these boundaries in place. But for a lot of people, it's really hard,
It's so
including
hard.
myself. I've gotten better at it. I think I've mastered the art of boundaries these days, which the world is not used to, by the way. People get offended.
Right.
That's another whole
That's why
podcast.
boundaries are hard. Yes. That is a whole other podcast.
But they're so important. And for me, they were crucial. And it started in that moment when I said, I don't know, I want to come in here and you don't know anything about me.
Right.
And if I want to tell you about my trip, I'll tell you about my trip.
Right.
And you were like, okay. So I left and I felt shame. I'm like, who am I to tell this person that is helping me get off my feed?
That's
but
what
it
happens.
also felt empowering.
That's what happens with trauma, especially, but with so many things that happen to us. I feel a lack of power. I feel like setting that boundary makes me bad. I made the other person uncomfortable. And that's why sometimes we end up in repeated cycles of trauma because I don't want to make you uncomfortable. And now you're asking me to do something that I'm not comfortable with, but you seem upset. So then we just let it keep happening. And it starts with something like follow me on social media, but then it's setting physical boundaries and sexual boundaries and emotional boundaries and all the bigger stuff, right?
Yeah. And again, it's different for everybody. I do know that for me, my journey, and I've seen it also with some of my clients, boundaries is so hard for trauma survivors. Like if you've been through anything that it's any physical abuse, any sexual abuse, it's really hard, especially in intimate relationships.
Yes.
To come as you are, number one, and not kind of like pretend to be somebody else, to be liked or to be accepted or to be normal and to not be damaged. I felt damaged for so many years. I felt like a disadvantage. Like I would date people that I knew were not good for me because I'm like, I'm not great. I'm not.
Yes, we end up dating down is how it's been described sometimes. I'm a 10 and I should date a 10, but I don't feel like a 10. I feel like a 2 because I feel damaged.
I think I allow
a 2.
the disrespect and the mistreatment and But then when you start getting to know you and you start healing and then you start understanding trauma, that's another thing. You have to understand the trauma. You have to understand what happened to you, and not necessarily answer the question of the why, but what is doing for you in this moment and how can you change your relationship with it. For me, that was huge, changing my relationship with my trauma in terms of befriending it, number one, owning it and sitting with it, and being uncomfortable with it. Like this happened to me, and that's that, and it happened and it's part of who I am, and I love who I am today. I love who I am today.
And you're a remarkable example, but not everybody's going to end up as where Diana is. So let's set that up. But traumatic growth is a real thing. That through tough times, you're forced to really do this hard work. If you haven't had trauma, then life is maybe not easy, but you don't self-reflect the same way.
But if I love who I am today, then I get to love who I was because I am who I am because of where I come from. And I do believe I would not be who I am today if I didn't go through everything I went through. And I put myself through the journey of healing, which again, a lot of women, especially, it's really difficult because it's not easy. It's not pretty. It's messy. It's painful. But it would not be more painful than what you going through without having support and doing the work.
Yeah, the cheesy line is the only way to heal it is to feel it, right? Like you
Mm.
have to feel it, you have to face it.
And then you get better at it. Like now,
Yeah.
anything happens, and I don't know. I feel like I can handle it better.
Well, because one of the things that you have done in psychotherapy, but also in different things you've done to heal yourself, different modalities, is you've gotten used to telling the story. And that's a big thing that we do in trauma work. There's different ways to do it. Every clinician has their own style, but it sort of forms like a callus or a scab. Like now it
Yes.
doesn't hurt as bad because I've been exposing it enough, and that exposure to the thing makes the thing that doesn't bother you as much.
Yeah, absolutely. And I understand a lot of people. I mean, it took me a long time. It took me almost 20 years.
Right.
I just started sharing like vulnerably maybe 2, 3 years ago. Even as a clinician, I would hide it from people. And I would hide it because when I tried to share back in the days, um, I also had a supervisor in a treatment center that told me, grow up. Like, what do you mean you're having a conflict with this client? This was a client that went through a lot of trauma, and listening to her reminded me of my own trauma.
Mm.
So it triggered something, and I wanted support. So what do? You go to your supervisor and you tell them, "This is a safe space. Can I tell you what happened in session with this client? I think it triggers something. I don't feel comfortable seeing this person. I need to go now and look at what happened to me within me to get better, and then come back, and see people like her. But right now, I'm not capable of seeing somebody like her."
But that right there can compound that trauma.
Yeah.
That it doesn't minimize the original trauma, which is its own horrible thing. But then when you seek out support and somebody's dismissive or minimizing like that, then yeah,
And
okay.
it happened a lot, unfortunately.
Yeah.
It happened a lot as a clinician where I felt like I had to hide my story or what I went through, only because, you know, other clinicians would look at me differently, and it was a lonely space. And I'm pretty sure a lot of us
Yeah.
had our own
Yeah, everybody's got a
traumas,
story.
but it became a norm that you don't talk about that. Like, you are the clinician, you are perfect.
Well, and that's something I've spent years trying to change the way I practice, because I started out uh, wanting everybody to call me doctor and wearing my lab coat in hospitals, and I am this authority. And over the years, especially in private practice, like it doesn't let the person connect with you, right?
Yeah.
Then I'm sitting up on my throne giving out diagnoses and all, and I really try. Anybody who's done therapy with me, I will see that I try to like tell my story. I even had one patient one time say, "Can you stop talking about you? This is about me." But I think it's important to show that like I do that too.
Yeah.
I feel that too. We're we're co-creating this.
Yeah.
The style that I work at is actually called feminist therapy, and not feminist like pro woman, but the idea is like we're co-creating your therapy. So I know stuff you don't know, but you know stuff I don't know. So we both need to put all of our stuff together, and we figure it out.
Yeah, absolutely. I'm sure you know, because you probably talk to these people, but I've sent a lot of people to you throughout the years, right? Like when I see somebody going through what I went through, and even if they come as a client, but I feel like I'm not there in terms of like, I don't know, I might not be available to treat them, or I don't feel like I'm doing something else, whatever the case might be. I usually, if it's a woman, if they've been through something like what I went through, I send them your way, because I feel like that level of connection is what makes the relationship thrive in a therapeutic environment. And I try to practice that too.
Yeah, yeah.
I don't want to be the master of
Right.
I'm not the master of your life, number one. I'm not the expert of your life. I don't know anything. And I tell my clients this, I know nothing. And that's all I know. I'm just here to hold that space and to connect with you. And when I feel it's appropriate, I share about me,
Right.
To let them see me.
Right.
But I don't want you to think that I'm perfect, that I have answers, that there's a book that I open and I'm like, oh, here it is, how you solve your problem. Absolutely not. And I tell my clients that all the time. At first, they don't take it well, some of them. It's like, because I tell them, like, if you came here to get something, I have nothing to give you. There's nothing to get. You're here to create. And I can do that with you. I can walk with you in creation of whatever you want. But the work is yours. The life is yours. The journey is yours. And that's how you get to where you want to go.
And the phrase I've started using, because I don't want to say I've got the answer or I know what your problem is. Like those, I don't like the way that. So I say I got you. That's what I want to like. I got you. I will be in this with you. I will give you the tough love when you need it. I will hear you when you are in pain. So I got you. But what that's going to look like, I don't know. Like, we'll
Yeah,
see, right?
yeah. And I think we use also to, as clinicians, and also I see it, I experienced that as a client, that when we start doing the CBT and we start doing the talk therapy, and time goes by and nothing is happening, and time goes by and nothing is happening, we get like complacent,
Yeah.
or we give up.
Yeah.
But there's so many things we can try. Like there's not one,
Oh my God. Yeah.
right? Like
And
there's
that's
so many things.
so. Let's talk on that a little bit, right? Like I've been pushing more. Try plant medicine. Try psychedelics. I've been encouraging folks to. We were just saying before we started the recording. I'm learning more about somatic experiencing and like being more in your body. And this is
I did so much of that.
the
in my
body
journey.
keeps the score. You know. Yeah. You've done retreats. I've done some retreats.
I've done the sound healing. I've
Okay.
done the movement, like
Yeah.
with the music, and just letting the, like just
Feeling it out. Yeah.
expressing
Yeah.
and
Release.
feeling, and I remember at times just crying and then smiling and then feeling light. I can't explain it. I don't know how that works. I'm not like, um, the back end. I don't
Right.
really know
Yeah.
how, what it does to your brain, but something does happen. And I don't think people should just go through one experience. Like, if one modality is not working for you,
Yeah.
then start adding other things.
Yeah.
Like whatever that is for you. I don't know. It's a map. It's a roadmap. Start
Mhm.
building that with your therapist.
And realize that sometimes it's a timing thing. People say, "Well, that wasn't it." I think about it like food.
That too.
Like
yeah.
if you're in the wrong headspace or you're too young the first time you try a food from a different
Yeah.
culture and you go, I don't like that. Well, try it again later. Maybe it hits your palate a different
Yeah.
way at a different time. So it may not even be the modality or now the clinician match matters to me. I think that it either works or it doesn't. You don't need to come back to that.
Yeah.
But the modality, yeah, you got to like see where you're at in the journey.
I agree 100%.
You know, I wanted to ask you, just for people listening too, like, what was it like telling your story to a male clinician? Because that's something that people often wonder, well, would I be able to, like, does that matter? Now, you said you were losing trust in women, so maybe that's part of it. But
So at some point I didn't like any, to be
Okay.
honest with you. I had a phase in my pain and my trauma, my suffering, my worst times. I had a phase in which I didn't trust any. I didn't trust men. I didn't trust women.
Yeah.
And
Everybody's
I didn't
gonna
want to
hurt you.
relate
Mm-hmm.
to any of them. So I became very isolated, and I felt like I was becoming like even a tomboy.
Yeah.
Like I was not in my feminine ever.
Mm.
I learned to survive by being in my masculine and
Mm.
being super tough, and I just didn't like anybody. I didn't like people, which is insane because now I love people. Back then, I did not like humans at all. So I was very hateful and very angry. And I started my journey with two. My first therapist was a female. My second one was but my first one dropped.
Yeah.
It really traumatized me
Yeah, that's
because I'm like, why? Like, I don't remember what she told me, but somebody that it was, I was still in my master's
Mhm.
program, and she knew somebody like my supervisor or whatever, and they connected. And she was like, like she learned my story, I guess. I don't
Yeah.
know, my background. And she was like, no, I don't think I can see you. But it was very painful and
Mm.
disappointing because I had already 3 sessions with her for the first time. And I'm like, do I have to now go back to
well, and
somebody
it's like a
else?
breakup. It's like a
like a
relationship breakup.
breakup.
I need to know whether me or you or
Yeah. And then I went to my second one, and she was great, but then she was too motherly.
Mm,
And
okay.
I didn't need that because I was also angry at my mom and everybody. Like I was angry at everybody.
Which might have worked for some other patient, but it
Exactly.
just wasn't where you
It
were.
just
Yeah.
didn't work for me. And I felt like now looking back, it's like the listening part. Like listen to your clients,
Mm.
right? We listen to the clients, and we hold the space for what they need, not what I want or what I think they need, but what they're telling me.
Right.
And I felt like, she was pushing so much for, obviously she wanted me to be okay, she wanted to help, but I was receiving that as like, you need to back off.
Mm.
And then she started with religion, and at the time I wasn't ready for it.
Right.
And she
Right.
called a priest, and she set me up with a priest for an appointment, and I showed up, but I was just not okay. And,
Yeah.
and then I felt like it was all forced, so I
Okay.
fired her. And then I went to another one and I started falling asleep in my sessions with her. I don't
Oh
know
my.
why. Like I was so bored. She was just not talking.
Hmm.
And then I was done. I'm like, I think I need to transition into a male therapist. And that worked better for me.
Okay.
So I came to you and it felt like I always, I used to tell you this, and I think I told you recently when we reconnected that it always felt like an unconditional support with enough space for me to figure it out. If that makes any sense.
Well, because you had so many resources just in you, right? Like you knew you knew Diana best, and that was it. Was I just try to remind you who you are,
I
whoever's
love
sitting across
that.
from me,
Yeah.
but you like I don't know if this is okay to share, so you can tell me. We can edit later, but Diana has books of poetry out there,
Oh, yeah, remember that?
and
Like,
and that's I thought that was a great way to express yourself, and so much of it was around femininity or sexuality or intimacy, and it tied right into your healing journey, but you didn't want to see it.
yeah,
And like there, you're already doing this.
because it
It's
was a
right there.
shame.
Ah, yeah, exactly.
Like I've been writing poetry since I was a little girl,
Yeah,
and for some reason there's something sensual to
yeah,
the way I write.
yeah.
Even in any document, sometimes I write stuff and people are like, "Oh my God, this sounds like
Erotica,
provocative,"
yeah.
and I'm like, "It's a professional doc. It's like I don't know,
It's just the way I talk.
it's a policy and procedures. How can
The
this sound
sexiest policy and procedures.
for real?" I get that sometimes. It's like so poetic, and I'm like, really? Like I don't know how to write differently. It's something that comes from within. And I love writing. So I wrote that book and it was all sexual erotic
Mm-hmm.
poetry. Very clean, I
Yeah,
think.
yeah, yeah.
But it was a lot.
Yeah.
And I remember struggling when I published it because it felt like very shameful. Like, oh my God, what are people gonna think of me? Because sex is a big part of women when they're traumatized
Yes.
by sexual abuse,
Yes.
physical abuse. Um, Intimacy suffers. Something happens with intimacy with yourself and with your partner.
Mm-hmm.
And I was going through that I
Mhm.
didn't feel sexy or I didn't feel confident enough to be with a partner and embrace that part of me.
Yeah.
They're going to think I'm too much, or they're going to think I'm dirty, or
Right.
they're going to think it was just.
Which is coming out of that trauma narrative. Maybe
Yes.
this is who I am, but now I am putting this spin on it. Now because of what's happened to me, therefore it's dirty. When
And
maybe
in
I'm
all
just
honesty and fairness, in my defense, I I disclosed to some partners throughout my journey what I went through.
Yeah.
And at some point, it was used against me. And I remember clearly working through this with you in sessions where I told you, like, I'm so angry because if I have a partner, and at the time I was
Yeah.
dating somebody,
Yeah.
and I share with him, this is where I come from, this is what I'm working on, be patient with me, like, there's work going on, but there's so much work that needs to happen. And we got into an argument one day, and he said, "Well, that's because you were abused, and that's what happened to people that were raped, or, like things like that." And it was so
Yeah.
painful and traumatizing. So, being in relationships like that would re-traumatize me over and
course,
over, and embrace that shame. Like it would remind me of the shame. So that particular person that I was dating, he told me, "If you publish that book, we're over, because this is like disgusting. It's too
Yeah,
much,
this is
and people are gonna know."
I don't
like,
approve of this
Yeah.
part of you.
Yeah. So when it happened, and obviously we're not together. We broke up right after. But owning that and feeling that.
Well, and I bring that up because I think it's part of owning all of who you are, right? Like I think whether it's trauma or whatever it is you're struggling with, like you need to see you, and something I try to do is just like I see you, and let people see themselves sort of in the mirror of me, right? Like I hope I'm not putting my spin, my stuff on it, but like
Right?
this is what you're bringing to the room. This is what, so maybe correct me if I'm wrong, but do you see this in you? And some people aren't ready to see it, or some people are scared to see it because they're scared of how, I mean, you're a powerful individual. There's a lot of Diana. And so sometimes it doesn't feel good or
It
safe
didn't
or
feel
overwhelming.
like people would tell me all the time, like, "Oh my God, you're so amazing. You're so this. You're so that." And I'm like, "Oh, like I wouldn't believe them. I would
Yeah.
come back." And the one thing you don't want to happen happens when you don't want it to
Right.
happen. And for me, was the sex, let's say sexual part or sensual part. People would tell me all the time, "You're so sensual. You're so like, exotic." And I'd be like, "But why? if I'm trying to be a man, a tomboy, like I would wear hats and
Which
like I would not dress sexy.
And that's an important thing for people listening or watching to know that after a sexual assault incident or something in your youth, there could be a for women especially, like, I'm going to tone down my
I didn't want
sexuality.
that attention.
I don't want you to see me this way.
Yeah.
I'm going to dress differently. Some women change their body shape or their weight.
Yeah.
Like, I just don't want to be
Some women
perceived
get
as a sex
confused
object.
with their sexuality,
And this could happen as well.
they
Yeah.
can,
I feel
like
same
maybe I'm a
with women.
lesbian.
Yeah. Mhm.
So all of it is a trauma response. And
Yeah.
for me, I went through
Trying to
all
find a
of it
safe space.
in terms of like exactly like literally like hiding. I'm
Yeah.
minimizing myself.
Yep.
And I don't want to step into a space, even at work. I don't want to be a star. I don't want to be acknowledged. I don't want to be seen. So I will do my best. But then guess what? I will still
Right.
be
Yeah.
acknowledged.
You
I
can't
will still
not be you.
seen. And I was like, what is going on? And now, obviously, I am who I am and I own who I am. And I don't have a problem being called sexy or dressing in a sensual way if I want to and embracing that part of me in my relationships. But I think that was the hardest
No, that's a big one to
part.
get past. Yeah.
That was the hardest part.
Well, especially because with intimate partners, I want to feel like I can be my real self.
Yeah.
We all have a professional persona or something. We know how to kind of like turn things on or off. But with your partner, you want to feel like this is me. I don't need to edit.
Yeah.
But yeah, if you're being asked to edit, then
But imagine, women that go through trauma, sexual abuse, physical abuse, having all of this going on, which I know, by the way, a lot of women that have been through abuse,
mhm,
all kinds of abuse. And we know that, 1 in 3
right.
globally suffer or experience some sort of physical or
Yeah,
sexual
that number's
abuse.
gone up. When I
And
used
it's
to think it was
going
1 in
up.
4. Okay.
Okay, no, it's one. I know. I checked today because the last time I checked, it was 1 in 4.
Yes.
And I've been repeating that for years, but because we were doing this, I'm like, let me just
Yeah.
take a look at it. So
Okay.
now it's 1 in 3,
That's sad.
which means that it's very, very sad. Like if you are a man and you have women in your life and you're sitting at a Thanksgiving table, you can look around and all these women, mom, sister, friends, daughters, 1 in 3 experience abuse, and they go through all these processes in which they feel shameful. There's so much that happens.
Yeah.
If they don't get the support, if they don't get the help, if they don't go through the journey, imagine living life like that and then being in these marriages
Right.
and relationships when they're feeling all of these feelings, but they can be honest with their partner because they're afraid that they're going to be judged.
Mhm.
Or the man is going to receive that as like, oh my God, TMI, now what do I do with this?
When that happened,
Am I responsible for this?
a patient of mine, she shared her experience or part of it with a partner, with somebody she was dating, and it completely altered the relationship. He suddenly felt like he couldn't touch her in any kind of intimate or
Yeah.
sexual way. He wanted to like protect her, and it became almost like a brotherly kind of thing. And she was like, no, I was telling you this because I felt like love and trust, but he didn't know what to do with that, which is not his fault, but like it shifted the dynamic.
Exactly. And that's why I think we have to have these conversations and we have to have these, create these spaces for people to talk about it because men also need to step up. And men
Yeah.
also need to own that. Again, 1 in 3. So there's going to be somebody in your life that has been through this, if not multiple women in your life. And how do you handle that? How do you hold that space? You don't have to fix it. You don't have to do anything,
Mm-hmm.
right? Like people feel like, oh, am I responsible now?
I would just
Do I have to take ownership for this now? And how do I handle you now? And it's like, no, you don't have to handle me. All you have to do is understand that when I tell you, hey, when you do this, I feel this, can you stop doing this? Or I make a request for a different way of,
Right.
Maybe.
And it's
maybe-
everything. It's not just intimacy. It's not just in the
Yeah.
bedroom. And that's where I think a lot of, especially male partners, think like, why are you getting so triggered? Like, we weren't doing anything sexual. Yeah,
That's
but
a trendy word now, by the way. Oh, you're triggered. You're
yeah,
triggered.
I know. Triggered
Right?
is there's a difference between real triggered. But yeah, it can be that I made a loud noise. I got upset as your male partner, and I slammed the door, and that can be triggering. I didn't touch you, but we need to have that dialogue of, hey, when you do that, it makes me feel some kind of way. And can you just not do that? I don't need to tell you why. You're not going to really want to hear why, but
Yeah.
could you just
you
honor
know,
that?
when you start healing, when I started healing and I went through my journey, I realized that I changed, right? So when you change, people around you change.
Yep.
And some of the parts of me that were not serving me anymore were gone, right? like there was parts of me behaviors that
Yeah.
they were not
Yeah.
aligned with the person that I want to be and that I am becoming as I go through my healing journey. And so those parts are kind of like fading, like they're not there anymore. So you walk into a relationship like I do now, um, with confidence, owning my sexuality, owning who I am, owning my past, my story, and then you bring all these tools and boundaries. Men are not used to that sometimes because
Mm.
I've been told like, but why are you talking about this? Why do you want to talk about everything? Why do you make so many requests? Why are you so open about it? Like men, and I don't want to say men only. I mean, I guess in general, society does not function like that. But once you start healing and learning and walking in that confidence, you realize that there's a lot of education and there's a lot of things that happen because you're now bringing your new self into all these relationships and people are not used to it.
And that and that's a whole other podcast
It
about dating
is.
and
We have like
relationships.
four
Okay,
now.
we've got a lot of topics, but I tell all my folks that like you want to come in like that and scare off the wrong fish.
Yeah.
Like that's you want to fish with the right bait. And so if
100%.
there's a partner who needs you to be quieter or smaller or less sensual or less, then he was never going to be your partner. So
For
I'm
real.
glad we saved each other a lot of time because this me is not going to change. This is what you're buying. So if they're not interested in buying this, then go somewhere else.
Yeah, and it's sad because a lot of women that have been through trauma, untreated trauma, that's what we do.
Well,
We
because
do that. We shrink.
well, because you want love or approval, and you feel, and like we said earlier, you feel like damaged goods. So I feel like this is as good as I'm going to get, because once somebody finds out who I am or what I've experienced, then they're going to kick me to the curb. So I better be really easygoing and really appealing in other ways.
Yeah. I think the gift of recovery is that not only you get to know yourself and not only you get to own your trauma and work through it and face those demons and shift and change and gain all these amazing tools, but I think it's also, at least for me, like I'm not on the sales rack anymore.
Mm,
Like I'm not on
Well
I'm
said.
not on clearance
Yes,
anymore.
love that.
Like dude, like
No,
no.
this is a luxury item.
Like no. Like I have value and I bring value. And guess what? That path is valuable.
Yeah.
Because of it, I am who I am today.
That
I
made
know
you
what
this.
I am.
Mm-hmm.
I mean, I know. I it's just a gift. And I know it's hard. Like I didn't see it this way when I was going through my pain. I don't want to tell people, oh, what happened to you is a gift when you're suffering and you're going through the pain of being abused or rape or that's not what I'm saying. What I'm saying is once you start looking at it, dealing with it, finding the right fish to,
Mm-hmm.
uh, finding your tribe, getting to know yourself, loving yourself, you start removing yourself from those racks where
Yeah.
people want to pay nothing for you and you're accepting any payment. And you're like, yeah, I'll take that abuse. I'll take that, mistreatment. I'll take this man that doesn't even, care. Or I take even from family members, from people in your life, right? That they mistreat you or they continue that cycle. And you're like, I'm not that person anymore. This is my boundary.
Well, and while we're on that, let me just say, I don't know how much time we got, but like, I think we're talking about big T trauma. We're talking about assault or abuse, but there's small T trauma that can be repeated
Yeah.
and that can lead to you making these same type of relationship decisions or having these self-worth issues. And that's more, you might have been overlooked as a child. Your parents might have fought, or maybe you occasionally got teased. Maybe you felt like you couldn't get your mother's attention. And so these things that you can't point to that one day, that thing that happened to me, but it can create this, what's called complex trauma. There's a bunch of words for it, right? But that'll still affect your choices.
Absolutely.
And I think so if people are listening and they think, well, why do I do this? Because I was never raped. Well, yeah, but something else might have happened to you, and it doesn't have this big exclamation point on it, but it can still alter your view.
And trauma is on the eyes of the beholder. Like you don't have to right?
Yes.
Like
yes.
even a simple little thing that happened maybe in school
Yes.
that somebody said to you. I used to
Yeah.
describe it to my clients in rehabs when we were talking about addictions. Like, what was that message that was planted in your heart?
Mm-hmm.
In your heart, somebody put this little message of you're not good enough, or
Mm-hmm.
maybe a professor, maybe your mom, maybe somebody in your life said, oh, I don't know, get it together. You're like, you're stupid or what? And that
Right.
message.
No, I've dealt with
You
that.
know,
Patients that
so
one time my father called me stupid and
and
like,
that's it. You're
yeah,
done
he
with
didn't
it.
slap me, he didn't abuse me, but that's it.
Or that
That's stuck.
neglect, right?
Yeah.
The neglect that maybe they're not paying enough attention to
Hmm.
you, and you grew up thinking that, I don't matter. I don't.
And
I'm
so I
not.
need
Put
to
the exactly.
devalue myself because if mom and dad didn't pay me attention, who's
Exactly.
going to pay me
So
attention?
whatever that is,
Yeah.
if you peel that onion and you're able to face it and befriend that part of you that might not be as great, or something that happened, or that message, you're willing to kind of like look at it. And I'm trying to remember what they say in computers when they change the software, maybe, like when they
Yeah, when you
they come
change
in and
the
they do,
yeah, yeah,
like, if you're willing to like really acknowledge that, okay, so this was said to me, and I've been operating my whole life as if this is true,
right?
but is it really true?
Yeah,
I mean, if you have a career, you're really stupid.
right.
If you pay your bills, are you really stupid? If you've been able to have friendships,
Challenge
I,
that.
like,
Yes.
can I go back exactly and challenge that and realize that no, I'm not stupid,
Mm-hmm.
and then go back to your Thanksgiving and sit at that table and not act stupid
Yeah,
to
let's
prove that right.
rewrite this narrative.
Exactly. So, I mean, I think the work that we do is so beautiful that if people really will give it an opportunity, they will see the value.
Yeah, but it kind of stings along the way, and I
It
think
does.
that's yeah.
It does.
This is
But
not.
hello,
It doesn't
life
feel
stinks
good. Yes.
sometimes. Like, you go to an office and you have all this drama. That stinks.
Yeah.
That's life.
Yeah.
You go through a breakup, divorce, people cheating,
Yeah, I
people
guess that's true.
lying.
Yeah, we can't
Yeah.
avoid it.
I mean,
Yeah.
like, what do you like?
But that's the common complaint I get. Like, oh, I don't want to do that. I don't want to cover that topic. I don't want to. It's gonna feel bad. But yeah, you probably feel bad already anyway. So let's just do the
And
damn
it's not
thing.
going to be as bad as it was, first of all, when it happened.
Right.
But also, if I'm telling you that drink this medicine, which we do sometimes, it's like, oh,
Right.
it tastes really bad. I don't like it, but it's going to make you feel better.
Right. Yeah. Who
I
doesn't
mean,
want to get on the
why
other side
wouldn't
of
you
it?
do it? Like, give
Mhm.
it a try. And I will argue that it's not as bad as people think it is. If you start shifting that mentality and start changing the relationship with yourself, because if I befriend myself and I want to be my best version, I will be excited to like look at the part. And I know, again, this is me talking now. This is not me talking
Right.
like
Yes, I would love
not
to
even
have
last week,
24-year-old you on the
right?
couch. What did
Exactly.
she say? Yes.
Or even last week, like,
Yeah.
this is an ongoing process. Like, I look back and I'm like, okay, last week I had this moment I'm not proud of, but I learned from it, and now today I'm talking about it differently. It's an ongoing process. But I don't know.
And it's idiosyncratic to everybody. And so those watching or listening, you're not going to end up like Diana because there's only one Diana.
Exactly.
Okay?
Your journey is going to be
You're
different, but it's
gonna
going to be
be you.
amazing too.
But it's worth doing this because your journey has not been all sunshine and rainbows.
Yeah.
And like you said, even last week may not be sunshine and rainbows. But you have more resources, you have more self-worth now.
Yeah.
Like it was worth doing the thing.
It was so worth it. And I'm telling you, it was bad. It was painful.
Yeah.
It was messy. It was up and down. I would just go through 3-6 months of having, being in a program and working and doing the deep work, and then feel better for a little bit and then crash again. And I was like, what the heck? I just went through all this for nothing?
Right. Right.
But it's not an immediate fix.
When you
It's really
fall
not.
forward is what it is. Like there's an image I've seen of like it's like the 2 steps forward, 1 step back, or you're going up the hill but you fall down. Something like all these images. But
guess what? I
it's
will
not
get
linear.
up and go up faster
Exactly. Yes.
and lighter.
Yes. And I know I can. And that's so much of it. It's just knowing I can do this. I can, because if I handle that, then this is cake. All I got to deal with today is a parking ticket, and I dealt with all that.
Listen, that is on point. Like, I have people that tell me, but oh, you're so full of positivity, and you don't get upset about anything, which is not true, by the way.
Which is not true.
But that's their perception.
Right.
And I'm thinking, no, it's not that. It's just like I pick my battles, and
Yeah.
I've been through so much. I've been on the floor so many
Mhm.
times wanting to die. I've been thinking about dying for so long that now all I want to do is live my life, and I don't let little things get in the way of that.
Yeah.
And when I do, I go through it, and then I look back like immediately and I shift because I'm like, am I sweating about
Mm-hmm.
this little thing or this?
Perspective.
Yeah, like it's a matter of perspective. I changed that perspective because I see it differently now. I don't know. I can't tell you how, why, but that's what happens when you start working on yourself and
Yeah.
you start healing and you start getting to know you and when you're not on self anymore.
That's it. I think that's a good place to end. That's beautiful. Thank you for proposing this idea. I really appreciate you reaching out. This is so cool. And I hope people get something out of this.
I
But I
know. I
think
hope we created
we're
value.
starting a
And
conversation.
yeah,
And we did talk about some hot topics here. So if you've experienced rape or assault, or if you have suicidal thoughts, please do reach out. There are hotlines that are free if you don't feel comfortable paying fees, or if you're not ready to tell people in your life yet. But make sure that if any of this brought up something for you, that you get the help you need.
night at A, you can call, you can text, you can talk to somebody 24/7, 365 days. So